So regarding clinical trials right now, are there any clinical trials that you are conducting or that you're particularly excited about for patients that they might want to ask their providers about?
Yeah, so we're also looking opening trial for frontline follicular lymphoma that looks at the use of bispecific antibodies. So I think that's very exciting because in general it's a well-tolerated therapy, and I think if it gives us a chance to produce very good outcomes, but without the toxicity of chemotherapy in the frontline setting, that to me is super exciting for patients. We're also looking at different bispecific antibodies. So the currently approved one targets CD20. We have a CD19 targeted bispecific antibody that I also think is, exciting to look at the potential for different targets, because then once a patient has had one, you're targeting something different, and the thought is that they might still be able to respond to a different one.
Yeah. So with bispecifics, then, is that continuous therapy or is that limited duration
It
therapy?
actually depends on the bispecific. So they're in follicular right now. The one approved is for a limited duration. When you look at a few of the others that have been approved in other lymphomas and are being studied in follicular lymphoma, there's a little bit of a variation between continued treatment and limited duration therapy. I think what's exciting about a lot of the combination studies is they are more looking at a defined period of time with the combinations.
Which I'm sure a lot of patients love to hear, that limited duration. There's an end to this possibly. So yeah.
Yeah. Nobody wants to be on treatment forever.
That is true. Yeah. Well, thank you so much for that important overview, Dr. Maddocks.